Hello, welcome to your channel. Thank you for watching. Follow and like for more videos. Please subscribe. Depression statistics in 2023.
1. Depression statistics at a glance. Depression can be hereditary. People who have an immediate family member living with depression may have a 2 to 3 times greater risk of having depression, according to Stanford Medicine. About 20.78% of adults in the US, or 50 million Americans, live with mental illness, per 2018 to 2020 data from Mental Health America. About 21 million adults in the US, 8.4%, have experienced a major depressive episode. Adult women are more likely to have a major depressive episode. The prevalence among women is 10.5% versus 6.2% among men, according to statistics from the National Institute of Mental Health. 4. People who reported their racial identity as 2 or more races had the highest prevalence of major depressive episodes, at 15.9%. More than 1 in 10 young people in the US are living with depression that disrupts their school, work or home life. 17% of people ages 12 to 17 have had one major depressive episode within this past year. 3. Young adults aged 18 to 25 are at the highest risk of a major depressive episode per a report from the National Institute of Mental Health. Depression is more common in people who give birth. 10% of pregnant people and people who have just given birth experience depression, according to the World Health Organization. The severity of symptoms range from 2.8% of U.S. adults experiencing severe depression symptoms, 4.2% experiencing moderate symptoms and 11.5% experiencing mild symptoms, per 2019 statistics from the Centers for Disease Control and Prevention. Mental health conditions were exacerbated by the COVID-19 pandemic, according to the CDC. From August 2020 to February 2021, the percentage of adults with a diagnosed anxiety or depressive disorder went from 36.4% to 41.5%, with the largest increases in the 18 to 29 age category. 2. How many people experience depression? About 280 million people worldwide live with depression, according to the WHO. Depression affects all age groups. 1.9 million children aged 3 to 17 have a diagnosis of depression. Those aged 18 to 29 have the highest prevalence of depression at 21%, followed by those ages 45 to 64 at 18.4%, ages 65 and over at 18.4%, and ages 30 to 44 at 16.8%. A recent study by Gallup showed that 29% of Americans have been diagnosed with depression during their lifetime, with women and young adults more likely to be diagnosed with it, says Adam Siley, DO, medical director and head of psychiatry with Caron Treatment Centers in Pennsylvania. In terms of the gender disparity among depression diagnoses, there are both social and biological factors behind the higher prevalence of depression among women. Socially, women might be doing more emotional labor and caregiving in their families. That means the weight of many aspects of the family, childcare, elderly care, household chores, the family schedule, fall on women's shoulders. This creates a situation where women aren't caring for themselves physically or mentally, lack of sleep, good nutrition, exercise, personal boundaries, which increases the risk of depression. Hormonal fluctuations can increase women's biological propensity toward depression. Sudden shifts in hormones in certain periods of the reproductive lifetime, including pregnancy, postpartum and perimenopause, can affect sleep and mood significantly and spur depressive episodes. Depression, along with anxiety, has also spiked among young adults, especially during the pandemic. According to the WHO, social isolation and difficulties working, visiting family and feeling like part of the community are some of the reasons for the increase in depression and anxiety post-COVID. And as cases of depression and anxiety increase, the struggle to find quality mental health care has worsened. While there is an increase in people seeking help for their anxiety, there's a significant lack of access to mental health care. Untreated anxiety can lead to depression, so it's not surprising that we're seeing a rise in depression. Depression in America statistics. The average depression and anxiety rate in the US is 32.3%, according to the Kaiser Family Foundation. 8. In the US, depression is often accompanied by substance use, with a 50% increase in drug overdose deaths between 2019 and 2021, mostly due to fentanyl. 7. Hawaii has the lowest rate of anxiety or depressive disorder, at 23.9%. 8. Louisiana has the highest prevalence of anxiety or depressive disorder, at 39%. 9. The state with the lowest suicide rate, as documented by 2021 data from the CDC, is New Jersey, at 7.1 deaths by suicide per 100,000 people. 10. The state with the highest suicide rate, per the CDC, is Wyoming, with 32.3 deaths by suicide per 100,000 people. 11. The highest suicide rates were among adults ages 85 or older, with 22.39 per 100,000 people, followed by 75 to 84 years old, at 19.46 per 100,000, and closely followed by ages 25 to 34 years, with 19.48 per 100,000 people, according to 2021 data from the American Foundation for Suicide Prevention. 12. Across the U.S., certain racial groups and ethnicities are at greater risk for depression. 2020 data from the CDC reported that Latinx Americans were the most likely to report current depression, with a prevalence of 40.3%, followed by 31.4% in the other racial category, which includes Native Americans, Asian Americans, and Indigenous people, Black Americans, at a prevalence of 27.7%, and white Americans at 25.3%. Depression and health statistics. Depression is associated with a variety of chronic health conditions. For example, 51% of people with Parkinson's disease, 42% of people with cancer, 27% of people with diabetes and 17% of people with cardiovascular conditions also experience depression. 15. The first medical professional to which some Americans may report depression is a primary care physician, yet statistically, 50% of depression diagnoses are missed in a primary care setting. 16. Receiving the appropriate treatment for depression and other mental health conditions is a challenge for 28.2% of adults, per statistics from Mental Health America. 42% of adults report that they did not receive adequate care because they could not afford it. 3. One significant barrier to comprehensive mental health care is lack of health insurance. Of adults who have a mental illness, 10% do not have insurance. Those numbers are almost twice as high for Hispanic adults, with 19% reporting they are uninsured. 3. There are likely many more people with undiagnosed depression and other mental health conditions, but if they are unable to visit a medical practitioner and report their symptoms and get a diagnosis, they will not be able to access treatment. Depression that goes untreated may have health implications, including disrupted sleep, insomnia, and poor immune health. Untreated depression is also associated with chronic pain and chronic health conditions, some of which decrease daily function and social interaction, leading to further depression. The area of the brain that processes pain is adjacent to the areas responsible for regulating emotions. When we suffer from emotional dysregulation like depression, our pain receptors are turned on and pain signals from the peripheral nerves become amplified by the brain. These chronic conditions can be exacerbated for people who don't have health insurance, and therefore access to mental health treatment. Mental health and substance use disorders are chronic diseases that need specialized, longer-term care and follow-up. Most insurances don't provide that kind of care. Rural areas have fewer medical and mental health professionals, and there needs to be more incentives for mental health care practitioners to relocate to rural and underserved areas, he adds. Mental health care should also involve more accessible preventative care in schools and community organizations, including comprehensive screening, so that more people can actually get the diagnosis and treatment they need.